Today's video about can we stop and reverse hair aging, especially if we use FDA approved medical like finasteride and minoxidil, and what is something new, it is derma roller or meso roller, different names but all the same. Okay, then please mind that I am changing format of the video. I am not any longer show my appearance, my video of myself. It is to save size of the file and to upload the file in shorter while in shorter time. So and please also mind that this presentation you can read from screen, of course, and the presentation will be available but only to the privileged members of the project. So these people who support me. Okay, so let's go. Hair growth and aging represents a good model of human body development and aging. All babies grow a thin layer of hair all over their body while in the womb already. During development of a child from birth to adulthood, the scalp hair follicles start to grow usually at 8 or 12 weeks. And what is happening? The depth of the bulge, which is the site of follicular stem cells in the dermis, does not change much with age in childhood, whereas the inferior portion of the hair follicle grows deeper and deeper into the subcutis, and this is what I am telling, because skin is getting thicker and hair follicle grow deeper. And androgenic alopecia, it is like losing hair in men type, is the most common type of hair loss in adult men. That is characterized by follicle size miniaturization, so it is getting smaller, and also its depth is reducing with corresponding change in hair diameter and length, as well as shortening the growing phase. So as hair get short growing phase, the hair don't grow long. They fall out in when they are relatively short. And official medicine explains this alopecia by two factors: reduction of the blood flow in capillaries of the scalp, and too high level of dihydrotestosterone. And from my previous visit, please watch it because it's quite a lot of information. Visitors could learn that the real case of hair aging is stiffening of the extracellular matrix. It is my opinion, but again, I think it is quite solid. There is solid evidence why it is so. But modern medicine does not cure the cause. Does not cure this stiffening of the extracellular matrix, but only reduce symptoms mentioned above. And it is not surprising that the effect of such treatment is only short-term improvement in the conditions of the hairs. Yeah? So this is what it is recommended, to use some spray or lotion with medications, especially minoxidil, and then it is advertised that it is good tool to grow hairs. But again, this medicine is not reversing the stiffening of the extracellular matrix. Actually, it is quite vice versa. It is accelerating aging. It's accelerating, so no wonder that it works only maybe a year or not too long. And in year 1942, Dr. James Hamilton observed that castration in adulthood prevented the further development of male androgenic alopecia. Castration results in suppression of the enzyme 5-alpha reductase, which catalyzes the formation of dihydrotestosterone from testosterone, okay, in certain tissues, including the prostate gland, male testes, and skin, hair follicles, liver, and brain. And it is believed that dihydrotestosterone plays an important causative role in a number of androgen-dependent conditions, including hair loss, prostate diseases such as prostate gland enlargement and prostate cancer. 5-alpha reductase inhibitors like finasteride, and next is dutasteride, they prevent the synthesis of this dihydrotestosterone. Therefore, they are recommended by official medicine for treatment of these conditions, hair loss and this prostate gland enlargement. And finasteride is able to decrease circulating DHT levels by 65 to 98%, so almost shut it down. However, with such therapies, hair restoration parameters tend to plateau after a few years of continued use, and the beneficial effect of the finasteride on alopecia disappear within 12 months after the withdrawal of the therapy. Okay, again you see, if the cause of hair aging is stiffening of the extracellular matrix, then it is certainly getting to some plateau, and in time it will not work at all. It will, because extracellular matrix is stiffening, and with this finasteride it is stiffening even more, even faster. So it is actually making in long term it is working quite opposite. So it is only like you can use it for 1 year maybe, but again, would it be worthwhile to do? Finasteride is an anti-cancer drug used in treatment of prostate gland adenoma and male pattern baldness. Okay, this is alopecia, androgenic alopecia. So again, it is so common to see advertisement and on internet a lot of videos about that. Oh yeah, you can just take some pills every day and a man will take and have no problem. But they don't tell you truth. They don't tell you truth. And because what? Castration of adult males stops the progression of male androgenic alopecia. That's right. That's right. However, hair regrow, if it occurs at all, may be limited to hair shed shortly before castration. Finasteride taken orally and minoxidil topically are the only medications that are proven for treatment of alopecia, this androgenic alopecia, by the FDA, the United States Food and Drug Administration. However, these proven therapies have been associated with side effects such as skin irritation from minoxidil and sexual dysfunction in men. It is actually, again, okay, just let's continue, and I will talk about this again later. So indeed, almost 10% of the testosterone produced by an adult every day is converted to DHT. This hormone is many times more potent than testosterone. It's in estimation it is more than 20 times more potent than testosterone. And without testosterone, it is a man, no longer a man. You know, the muscle grow and all this, the masculinity and sexual erosion, it is all from testosterone. And this why old people, they are getting a reduction in the testosterone production, and also it leads to a reduction in of this DHT. And what I recommend, it is quite opposite, that we have to take DHEA, and this is to increase the production of testosterone. But they say, no, we have to shut down the production of this DHT. And so we have to shut down all the male functions. And too low levels of DHT in men can have the dramatic effect compatible with the result of chemical or surgical castration. This is awful, you know. If and then it is really awful. And if you take this medicine to stop alopecia, to stop hair loss, then you are getting to a castrate. And what is really not funny but quite tragic, then the former president of the United States, Donald Trump, was taking these pills while he was married the most beautiful woman in the world. Then again, to have such a beautiful woman and to be a castrate, it is, I don't know, I would kill myself if just incredible, incredible. And also look how his body changed. He got overweight. He got this a lot of fat accumulation like women have in old age, and then it is all the symptoms are the symptoms, typical symptoms include hot flashes. It is okay like post-menstrual women, but gradual bone density loss resulting in osteoporosis. Breast enlargement, it is, you are not only getting to a castrate, but it is like you are turning to an old woman with no masculinity. And weight gain because of accumulation and distribution of body fat to the hips and chest. And then look at him, what is the result? It is nightmare. I don't know, but yet FDA recommends to use the finasteride. Finasteride and minoxidil, and it's a little bit different, but yet, okay, yet look, it is what it is. So I was trying to find information about minoxidil because quite many people use it, and again there is a lot of advertisement and a lot of video in internet that minoxidil, it is perfect, and you can buy it in as a foam or as spray or lotion, and it's a lot of stuff about this, a lot of big business. But let's go into how it works. Minoxidil is an antihypertensive vasodilator. It is just making capillaries in the scalp larger. So this medication is used for treatment of high blood pressure as well as alopecia. Yes, but minoxidil applied topically is widely used for the treatment of hair loss. This is quite common, as I said. And they use some solvent which is okay, propylene glycol and polypropylene glycol, and it is, you can see if you get access to the presentation, you can click on the link and get to the patent. And there are many other formulations which include ethanol, glycerol, lactic acid, and water. This is again, it is just it is all not much harmful. It is actually not bad to have ethanol. It is to sterilize the hair from bacteria, because bacteria contribute a lot to hair loss in old age. Yes, we cannot keep this bacteria developing on our skin, and with age we can get quite dangerous bacteria. And then if you use some ethanol, it's okay, it's no problem. Okay, then there was some studies that where people compared impact of topical therapy on and measured the impact on hair density. It was normally 26 weeks, 24 weeks, 16 weeks, and all the procedure was almost the same. So 5% solution was applied twice a day, maybe 3-5 milliliters of this solution, and then they measured hair density before and after, and they discovered that yes, it is better, it is getting better. It is 12 hairs per square centimeters more, and if it is in other test, it was even 22. And in one more, only 2% solution twice a day for 16 weeks, so short a while, and 25, it gave 25. And even solution in the Dexane for 24 weeks, twice a day, the same as a publication, even 31. So it is certainly gives some impact. But look, it is only 6 months. Only 6 months. It is quite short. It is improving, but it is not improving further because you are limited with this natural process of extracellular matrix stiffening. Okay, what else easy to apply, and now it is getting more and more. to research and to use in cosmetic companies. It is microneedling. Microneedling, also called mesotherapy. Mesotherapy. This microneedling is a cosmetic procedure that consists of applying multiple injections with thin needles into the upper layer of epidermis, due to which medicinal preparations actively penetrate into the skin. Again, this mostly it is this mesotherapy is used to rejuvenate skin on face and neck, but it works for scalp too. So this microneedling stimulates the activity of epidermal cells, which increases the skin ability to regenerate. Yes, right. And the procedure is performed using a meso roller or mesopen. Meso-roller. This again only with difference that meso roller it's cheap and the mesopen is a little bit more expensive, more sophisticated device. And the length of microneedles in this microneedling devices can range from 0.5 millimeter to 3 millimeter. And 3 millimeter is already only for mesopen, not for roller, because roller with 3 millimeter needles is just will crush your skin. Okay, then microneedling can be combined with the injections of drugs or exposure to high frequency electrical fields applied to the needle. This again a big field for research, but not quite many publications on it, but it gets more and more popular. So, and also what I want to mention, it is becoming popular to use blood plasma from a patient for microinjections. So also microneedling is used as an anti-aging for the skin. It can be used to treat hair loss, right? And microneedling is thought to improve the proliferation of dermal papillae stem cells in hair follicles. Okay, look, the target is to ignite the stem cells in dermal papilla. In the papilla, it is, you know, this bulge. There is a bulge on the hair follicle. In this bulge, pardon, there are population of stem cells, and this is very vital for pigmentation of our hairs, but also for growing hair. And the use of microneedling but again, be cautious, because the use of microneedling under non-sterile conditions can lead to skin infections, hair loss, and scarring of the skin. Again, you have to be careful. You have to clean your hair and to apply some maybe alcohol to kill the bacteria. Otherwise, because epidermis is protecting our skin, protecting our body. But if we make this damage to the damage to the skin, and then all this bacteria can go inside and can make infection, and this is really dangerous. So be careful about this. So people use these plasma injections, and it should work. It is again, I will talk about this later a little bit. Even I have some proposals and discussed it with my friends. Can we do it with leeches? And okay, then I will talk about this later. But it's again, it's quite revolutionary technology. And this is mesopen. Mesopen. It has cartridge with many needles inside, and it like vibrates or stamping the skin, the scalp, and then to certain depths, and so it is also quite good device, quite interesting. And about, I don't know, a year and a half ago, I have a video on it. I got this meso roller, and I got it like 6 or 8 pieces with different lengths of the needles, and I tried it, but just was so lazy, and so it should be some routine to apply it every day. And but I will do it. I started the project of this skin and hair rejuvenation, and I hope I will do it. I didn't make it now yet. I only cut my hairs, and so I just now make some preparations. But then I will prepare all these lotions and treatments, and then I will do, and we'll see the result. Then what was also investigated the use of minoxidil, this microneedling alone, and then compared with combination of microneedling plus minoxidil, minoxidil, and then minoxidil, and then minoxidil alone. So you see three. Yeah, it is. But okay, it is not this publication. We will go further. And here there was comparison between this publication was about combination microneedling and this application of this 5% solution lotion twice a day for 12 weeks. Pardon me. And compared only to application of the lotion, minoxidil. Okay, minoxidil only or with a roller. And roller certainly gave the better performance, and 82% of the involved people in the test were quite satisfied with the results, in comparison with only 4.5% who used only minoxidil alone. Okay, then again, derma roller is working quite synergistically, yeah, but not quite. Okay, let's go. The derma roller 1.5 millimeter was used. It is quite long needles, and it was rolled over the affected areas of the scalp in longitudinal, vertical, and diagonal directions until mid erythema. So it is like your skin gets inflamed, red color. You see blood is coming, and then it was decided, okay, this is the end point of the procedure. And all patients were instructed not to apply minoxidil on the day of procedure, and to resume its application only next day, only in the 24 hours after the microneedling. And what they used only 1 milliliter of 5% minoxidil lotion applies twice a day. In hair regrowth induced, and they just speculating that hair regrowth induced by microneedling this is thought to result from controlled wounding induced by the derma roller, and the postulated mechanism include probably release of growth factors, direct activation of stem cells in the hair bulge area, and increased expression of hair growth genes. Okay, in other publications there were 3 groups of patients, and they were getting only minoxidil 5% solution. It is one group, and then they used 5% minoxidil, and twice a week they make microneedling with depth of the needle only 1.2 millimeters. And next was again minoxidil lotion 5% and twice a week, and depth of the roller was only 0.6 millimeter. And one more group, but the results were not good. There was a roller with 0.25 millimeter. Okay, so okay, they compared 0.6 and 1.2 millimeter, and 0.6 millimeter in combination with minoxidil was more effective than minoxidil therapy only. I mean, roller with 0.6 millimeter was working better than 1.2 millimeters, and of course better than minoxidil alone. And yeah, and okay, but okay, the next publication. And there was a review publication, and then the results were comparing microneedling monotherapy and okay, and they got only, if you use only microneedling, no minoxidil, no lotion, but it was quite good, quite significant increases in total hair counts. And then even there was some increase in hair diameter and total hair density. Yeah? But meanwhile, there were different tests, and in some tests it didn't work. So, and we will discuss why later. Researchers in other publication concluded that the microneedling effect alone was nearly compatible to this treatment with minoxidil in the intradermal injections. So if you use injections like with a roller, minoxidil with a roller, or you'd use only microneedling, this was quite compatible. So there was some synergistic improvement, but yeah, I would say not very much. And also monotherapy with minoxidil appeared to be limited efficacy in treating some cases of alopecia, this patchy alopecia areata. Again, you look that roller can work in some sort of synergistically with minoxidil, but it's if you use only roller, it is also working. It is not a problem. The optimal length of the needles for the mesotherapy depends on the stage of baldness development. This is my viewpoint. This is, again, it was not disclosed. I tried to explain why. So best effect is achieved when the length of the microneedles on the mesoroller or mesopen is slightly less than the depth of the area of the hair follicle. Yeah, we have this this area this with stem cells, and then we have to, if it is young man, this area of hair follicle of this stem cells, they are about 2 millimeters deep. So if younger men use this device, then you need a roller maybe 1.6 millimeter. And but with age, depth decreases to 1.2, even 0.8 millimeter, and accordingly you need to select the length of the needle. So you can get you can use, if you are in older age and you have already quite developed alopecia, you have to use the needles which are maybe 0.6 millimeter, not too much long. About this, because needles that are too long can damage the stem cells. Stem cells, and while too short needles will not give the stem cell stimulation. So you have to be close to this area. So let me look here. You see that we have this pouch area where the stem cells migrate along the surface of the follicle. They migrate to hair bulb. But if you damage skin too far, too long, then you can damage all your hair. So it should be some optimum. And again, it depends on age, because this age, this depth of the hair follicle is changing. It is getting shorter. So it is getting shorter because when this regrowth happens, this hair bulb cannot go deep because the extracellular matrix already is so stiff that it cannot grow through. Yeah, but in young age it is deeper, and also this pouch area is coming closer to the epidermis. So it can be concluded that the use of officially recommended hair restoration products is not effective for long-term use and has too many unwanted side effects. So my opinion that for skin and hair rejuvenation, we should practice microneedling and microinjections. Sorry, it's I translated from Russian. There was some problems with it. Okay, then injection. We have to what I will use. I started the project, and what I am going to use. I will use injection, this application of lotion solution of senolytics, and also stem cells activating drugs. And what is quite interesting, but I know I will maybe do it later because I don't have equipment. But again, we can use injections of the blood plasma serum. And then also drugs or this super enzymes to reduce stiffness of the extracellular matrix. Yeah, because It's again, it is just ideas. I will try to do it and I will see the results, because I cannot prove it, it's just my ideas. But from what I was doing before, I think it will work. I think it will work. So starting from injections and with this mesoroller injections of senolytics, and then there are drugs which may activate the stem cells to produce already other cells. Okay, then again, it's a big program, and I started. Of course, it will take time, and it will take time. And in my opinion, just my recommendation. I'm not a medical professional, but just listen to my recommendation. So don't use official these recommendations of the doctors. Don't use them. They have so many side effects. If you want to castrate yourself chemically, okay, this is your choice. But I doubt that anybody want to get this effect. But again, what is easy? Yeah, what is easy? Cloves. Cloves, you know that cloves is spicy cloves is a champion among spices for rejuvenation. Again, there is my video on it, and it is quite easy to prepare some mask and tinctures and extracts in oil, or take oil, clove oil. There is such oil, you can buy it, it's relatively cheap, and then you can use it instead of this minoxidil. Use it instead of minoxidil, because it was in use for 100 years, almost no side effects. Again, no side effects like minoxidil, because minoxidil, it is making your capillaries larger, but it is not reversing stiffness of the capillaries, because with my medications, what I used, I already have aorta and certainly capillaries more elastic. This I see in my blood pressure, that blood pressure now it's about 90 to 50, 52. So it is my blood pressure is the same like of an infant. Infant has the same blood pressure, but my heart is bigger, of course, and stronger, and my heartbeat rate is now it's a range of 45. It was 50 with something, but now it is going even to 42. So it means my heart is not swelling, but getting larger size and more stronger, because I practice. I am cycling regular and quite long, mostly 60 kilometers, some days 30 kilometers, even 100 kilometers. So so I definitely have some progress in it, and I see that if this medication works to make my blood capillaries more elastic, then additionally I can apply this cloves extracts, and with a roller, and I can ignite stem cells working, and I can accelerate this process of maybe I will get a return of my pigmentation of the hair, etc. So let's see. But again, it is quite safe, because clove oil was used as a remedy for that normalizes blood pressure, strengthens the heart muscle, as well as anti-inflammatory, bactericidal, antifungal, and wound healing, and anti-cancerogenic, analgesic, tonic, and drug. It's again health benefits of using cloves have been known for centuries, and clove oil has been used in cosmetic formulations for skin rejuvenation. So it is already known for centuries. Why you need this minoxidil, which is actually may ruin your heart? Instead of this using the folk medicine, but folk medicine, reliable folk medicine. And as I said, this case with Donald Trump, that it is again that he used these medications to stop alopecia, to stop this losing hairs, and he turned himself into into castrate. Why? Just quite much more easy to use this roller with clove oil or a tincture of tinctures and water extracts and oil extracts of clove powder, It is so easy. It is so, and even you can find on internet some recipes about how to make these extracts with water, with boiling water, or with oil. It's quite many, but again, I recommend you that follow folk medicine. Folk medicine is proven for centuries of years, and together with roller, again, roller already work compared to minoxidil about the same, and if you apply this clove oil and these extracts, it will probably, I hope so, it will give you good results. But also I will go even further, this is senolytics and some drugs to activate stem cells and blah, blah, blah. So, but it is okay, it is my site, my project, and I will probably not report it, not present it to public, because this is some maybe commercial project. And please watch my other videos related to skin rejuvenation. I was talking quite much. And what is most interesting for me, it is the use of medicinal leeches to produce plasma, blood plasma. So the leech is sucking blood, and then you, with needle, you take this blood out with some high-speed, high-frequency centrifuge, and you clean plasma, you separate plasma from blood cells, and then use this plasma to put for injections into the skin, and injections also to scalp. This is quite interesting project, and I was thinking that maybe my friends will help me, because here in Thailand I cannot find medicinal leeches. This is not available. There are tropical leeches which are jumping to your head and to your body in tropics, and then they are sucking your blood, and I had this awful experience. It is not good to use these leeches, but medicinal leeches is interesting technology. I hope that if somebody makes this business, maybe in appreciation of my advice, he will support my project. I would also be very glad that if it will work for somebody else. Okay, then further, but okay, again, trust folk medicine. This cloves, spicy cloves, is the way to go. Together with the roller already put like kind of modern tools, but cheap as dirt, and no side effects. So why not try? Why not to try? Again, be careful to combining these tinctures or water extracts of or anything else of the cloves, even if it has antibacterial and antifungal properties. You can maybe to put this infection pathogens into your skin. So be careful. So make a rolling, prepare quite good. So you wash your hair, and try to clean it, try to disinfect it, and then use the roller. So in the roller, of course, should be also disinfected in alcohol. Be careful. But again, this procedure is quite cheap. And again, I'm changing not only format of my videos without camera, my own camera, my image, but also presentation will be available as a part of my book. And together with my book, it will be available only to privileged members of the Rejuvenation Project. Sorry guys, I am trying to stay focused, and so no need to disclose all information. And if you want to check, go to sources. Okay, you can slow down the video and can type these references, and you can read your project. But also, if you will be very appreciative, and then of my you can send me email, and I will send you the presentation, but in return to some support, of course. So it is again a question of support. Otherwise, I will have not much funds to run it, and so support is important. Okay, important. But again, also if you support me, maybe we will support you in return with something more. Not disclosed to public, with something more results which are probably interesting. And look at the world. Donald Trump and all these leaders of countries, many leaders of the country suffer from graying hair and from aging hair and hair aging partner, and from baldness and alopecia. This is so big problem that even multi-billionaires cannot do anything with it, cannot do anything. And again, I take this project, and together with all the rejuvenation project, I believe that it may work. Again, I should present the evidence, okay, be patient. Or if you trust me, you can support already now. You can get access to all my book and consulting myself and or maybe with other members of the project. But again, I am not a medical professional. I am a physicist. I am doctor in physics, and officially I cannot give you any medical advice or consulting. It's just cannot work for me because but privately we can discuss, and you decide for yourself what to do, to follow these official recommendations with which make you chemically castrate you, or create problems with your heart, because you will have big problem if you will use this minoxidil. Then that you will get real problem with your heart in time, because again it is accelerating, minoxidil is accelerating aging of your blood vessels. My proposals, they rejuvenate blood vessels first in the skin, and maybe with this topical application of this tinctures and all this folk medicine, maybe I will reverse aging of hair, and I will skin also. Maybe I will look younger. Certainly it will take time. So you see, it is 6 months it takes to prove. 6 months, maybe 4 months. So it takes time. But I think it is interesting idea, especially you see you can go develop a lot of space for development, a lot of space that you can use this. Pardon me, this leeches, medicinal leeches, injection of plasma, blood plasma of this serum to your skin, and this is so powerful tool. And plus, maybe these medicinal leeches, they have very powerful enzymes which reduce stiffness of your body. This is stiffness of the extracellular matrix, and this is so I think a promising technology. Then again, if somebody will go to this technology, again, please. If it will work for you, if you will earn some money, please, I hope you will support my project, and you will get even more help from me, okay, in this direction. Okay, then what else? Yeah, so it's like this, and thank you for your time. Comment, subscribe, support my project, and ask questions. If you are a privileged person, ask questions. You can ask questions also in comments, and in comments I normally reply. And have a wonderful day. Thank you for your attention. Thank you. Ciao.